Dr. Shetty, thank you very much for being on Duologue. It's a pleasure to have you with us.
Thank you. It's my pleasure.
Just now I said India's population pressure is one of the huge problems in India, but that is also a huge advantage. The demographic
That is our greatest strength.
greatest strength. Like we are producing 120,000 doctors these days, but I'm sure the size of the country is so large that there are 5 times of that number are good enough to be a doctor who are passing out from their schools. So somewhere we will have to change the way we have been looking at things. On one side, we'll have to leverage this demographic dividend and try and think out of the box. Like you just said, that having a nursing college, which is not there. I don't think there are medical colleges attached to hospital, which was a need of the hour maybe 60, 70, 80 years back. But today you have to go beyond that. You need to bring nursing colleges attached to hospitals.
Varun, let me answer the first question you asked me about the insurance. See, the health insurance, what we are talking about is one way of delivering health insurance, but we are looking at a dramatically different way of health insurance. Our concept of health insurance is an integrated health care, wherein as a hospital, we take care of the primary care. Currently, the health insurance companies do not cover primary care. We want to take care of the primary care.
Primary care as in across OPD care?
Yes. Home care, primary care, secondary care, tertiary care. Now, when we become an integrated health insurance provider, it's called managed care, wherein you pay X amount of money to us. Then we will spend a lot of time in ensuring that you don't fall sick. If you are a diabetic,
yes,
we'll ensure your diabetes is under control.
That is what,
if you are a hypertensive, we'll control the hypertension. And if you ignore our advice, after some time we'll say, look, we are not going to insure you.
that is the model.
This is a model which is practiced in US by Kaiser Permanente, which is one of the largest health insurance companies in US. And it's called managed care. So by us taking care of your health, your interest and our interest is aligned.
Are converging, yeah. That's
the model we are launching.
Yes, so that is the model. That's a new thing, because that I'm hearing it for the first time. Managed care, the term that you've said, and that always had kept me up at night. That, you know, if I don't look after myself before falling sick, and I put it in a different way. I said that bring in changes in your lifestyle before the doctor tells you.
Yes.
Don't wait the doctor to tell you. Here, the managed care, you're saying that's what the managed care people will tell you. So maybe this intent, vision, coupled with technology, I don't think that is unassailable, that is unachievable. Because again, insurance, I feel that I was wondering that I've taken health insurance for last 25 years. I've never claimed it as yet. So
no, health insurance will be a game changer for a country of our size with 1.3, 1.4 billion population. Just imagine, Varun, if 100 million households, in India, 100 million households can afford virtually everything what they want.
Yeah, 1,000 rupees a month.
If 100 million households buy health insurance for the family by paying whatever the premium is, another 100 million households are supported by the first 100 million households. For the second 100 million, so-called people who earn about 20,000, 30,000, 50,000 rupees per month, if the first 100 million households support buying the health insurance for them, and if the premium for them is kept at a health insurance for the entire family at 10,000 rupees per year, which covers primary care, secondary care, tertiary care, which will sponsor even a heart operation, heart transplant, or a bone marrow transplant, or anything costing 30 lakh, 50 lakh rupees, if the insurance covers 10,000 rupees per year, then we will be able to collect 1 lakh crore.
Which is more than the
budget, central government's healthcare budget. See, we grossly underestimate our power of a country with billions of people. I just remembered, you see, when my little daughter, my princess, she was a baby, she was a little kid, she was very good with the jigsaw puzzles. When she was a little girl, she used to put all the pieces on the floor and spend hours and hours and try to put it together. When I one day entered my house and I saw all the pieces of jigsaw puzzle everywhere, and the little one sitting there and seriously looking at it. I looked at it and I said, "Honey, you can't do it." She looked at me and said, "Daddy, I can do it. All the pieces are there." This is the story of India. We have pieces to solve all the problems. Someone has to put it together.
Not someone, I think all of us, which is where again, a nice way of putting it. The solution is out there, but all of us, we have a tendency because of this scarcity economy. There are enough reasons not to do a right thing. And I always say there's only one reason. Somebody does something wrong, and I ask him, why was it done wrong? So when they give one example, one reason, I always say that I can add another 999 reasons why the right thing wasn't done. But to do the right thing, there's only one reason needed, which is intent. So that is where I think you are hinting at, that first we need to have the intent, that understanding that either all of us float or all of us sink.
Duologue with Barun Das featuring Dr. Devi Shetty. Streaming on the world's first news OTT, News 9 Plus. Download now.